Patient and family-centered care is a whole approach to taking the best possible care of patients. It's a way of understanding their needs, their requirements, and coming up with plans to meet those requirements.
The patient is the center of everything that we do, and without the patient, we wouldn't exist.
I made the choice to work with Bronson because I really believed in what Bronson was doing as far as partnering with patients and families.
In 2001, the Institute of Medicine published a report called Crossing the Quality Chasm, a new health system for the 21st century. It stated 6 aims that all U.S. hospitals needed to follow in order to improve quality and service. The aims asked for healthcare to be safe, timely, effective, efficient, equitable, and patient-centered.
As a parent, I feel safe in bringing my children here, knowing that they are willing to find every way to listen to the parents and cooperate.
Well, when I was here, they did the patient rounds where it's the doctors that take care of them, all the nurses, and they would all come together outside the room and discuss the treatment and what they were going to do and the type of medicine that he was on, and they made sure that I was okay with it.
In 2006, Bronson incorporated the Institute of Medicine's 6 aims, including patient and family-centered care, into our strategic plan for excellence. These are called Bronson's requirements for excellence.
We think it's important because patients and families are really part of the care team. They know, in many cases, as much or more than we know as providers. So it's important to incorporate their knowledge into the overall plan for that patient.
Bronson's partnership with patients and families comes to life through our commitment to the principles of patient and family-centered care. These important principles include dignity and respect, participation and collaboration, and information sharing. Patient and family-centered care at Bronson is defined simply as partnering with patients and families in care.
I've been involved, and I haven't felt like any question was a stupid question, or just that I totally been treated that a caring family member that is concerned about her mother.
When family members are there, we can gain a lot more information about a patient, about their symptoms, and the family members are the ones who can really reiterate what we tell the patients. Patients are oftentimes very overwhelmed, or they might not understand what we tell them. We may say it in one way, and the family can explain it to them in another that's more understandable. And I think then we just have better success and better treatments, better outcomes.
Taking care of patients involves everybody who's going to have really any contact with the patient here in the emergency department or in the hospital in general. How important family is, not only because they need to be good advocates for the patient, because many times the patient can't always speak up for themselves and defend themselves, but as well as, we hope that she's only in the hospital for a short amount of time. So when she goes home, who's going to be caring for her? And who's going to be involved in that? Yeah.
In 2006, Bronson formed a Patient and Family Advisory Council to further integrate the patient and family-centered care approach into practice.
When we first started the council, we were really a pilot project, but it was a new idea, and it needed to grow. And so we tried it out first with women's and children's, and so much of it just made sense. It really resonated with both patients, family members, and staff, that it soon became apparent to Bronson administration and staff that this was really a concept that should go system-wide, that all people in our system deserve to be treated as partners, and that they deserve to be valued as individuals and their family involved in their care. And so in 2008, we expanded the council to 42 members, which was a huge step for us. And that meant that we were now covering all areas of the Bronson system: adults, pediatrics, outpatient, and different ancillary sites as well. So that really meant that our membership had to be diverse and reflective of so many different types of persons in the community, as well as health situations and their health experiences at Bronson.
It's been a remarkable journey for me. I've learned so much from the patients, the families that have told their stories. It really has helped me improve my nursing practice with patients.
The Patient and Family Advisory Council serves as a formal group of former patients and family members who work collaboratively with Bronson staff to enhance patient care and service. The Council meets monthly to offer guidance on a variety of issues related to the patient and family experience. They provide valuable input on patient and family materials that help communicate important information to patients and families. Several council members serve on hospital committees to offer a patient and family member perspective. They round to talk with patients and family members in the hospital and evaluate waiting rooms in the practices. Members are also involved in process improvement Kaizen events to improve satisfaction and communication with patients and families.
But the patient always has to be first. So however it takes to make that patient comfortable, that's really what you have to do. And that's not always easy, and I know that.
I've had children in the PICU. I did have a son pass away here at Bronson. Then I had a child diagnosed with leukemia, and I don't know, it was just a way that I felt I could come and help other Bronson families.
And that's one of the best things about working here at Bronson is you get a chance to work with people from all sorts of life, all varieties, and get a chance to turn it around and actually help them when they need help the most.
Patient and family-centered care has demonstrated a positive impact on patient safety around the country at hospitals that have adopted this as their model of care. That is why we too have adopted patient and family-centered care as our model of care. At Bronson, we believe that through collaborative relationships and teamwork, we enhance quality and safety to ensure excellent outcomes. It is through the efforts of high-performing teams that we are able to partner with patients and families in providing care.
There's so much we can learn from patients and families. Of course, no one's more of an expert on what the patient needs than the patient themselves and the family. So it's important to value their opinions, their requirements. It's important to understand those. It's important to communicate both ways between patients and families so we understand what their needs are.
No matter what your position is at Bronson, it's important that you are aware of the Patient and Family-Centered Care Initiative and that you do everything within your area of responsibility to make sure that the patient has a positive experience during their stay here at Bronson.
One of these days, it could be you. And how would you like to be treated? And wouldn't you like to be partnered with? And wouldn't you like to have information sharing about what's happening with you? That is the part of the partnering that makes the experience here at Bronson so powerful.